Prepare to succeed with our top 20 Certified Nurse Aide interview questions and answers, designed to help you confidently showcase your CNA skills, experience, and professionalism during interviews. 1. Why did you choose to become a Certified Nurse Aide? I chose to become a CNA because I have a deep passion for helping others and making a meaningful difference in their daily lives. I was inspired by the compassionate care my grandmother received in a nursing home, which made me realize how vital CNAs are in patient recovery and comfort. Being a CNA allows me to provide essential care, emotional support, and comfort to those who need it most, which is incredibly fulfilling. 2. How long have you been working as a CNA, and what settings have you worked in: hospital, nursing home, home care, etc.? I've worked as a CNA for over 4 years, gaining experience in various healthcare settings, including nursing homes, assisted living facilities, and home health care. Each environment taught me to adapt my skills to meet diverse patient needs. In nursing homes, I managed multiple residents. In home care, I provided personalized support. These experiences have shaped my ability to provide compassionate, efficient, and professional care across different patient populations and healthcare environments. 3. What certifications do you hold besides your CNA license? Besides my CNA license, I hold certifications in CPR and first aid, which are essential for responding to emergencies. I'm also certified in basic life support, BLS, and I completed training in infection control and dementia care. These additional qualifications enhance my ability to ensure patient safety, provide appropriate emergency care, and support patients with cognitive impairments effectively. I continuously seek learning opportunities to broaden my skills and stay current with best practices. 4. How do you handle the physical demands of being a CNA, lifting, bending, long shifts? I manage the physical demands by practicing proper body mechanics, using assistive devices, and following training protocols to prevent injury. I stretch before shifts and maintain physical fitness to support endurance and flexibility. Taking short breaks when possible helps me stay energized throughout long hours. I also prioritize hydration and nutrition. My experience has taught me how to balance physical effort with smart techniques to ensure both patient safety and my well-being. 5. What do you find most rewarding about being a CNA? The most rewarding part of being a CNA is knowing I've made a positive impact on someone's life every day. Whether it's helping a patient feel clean and comfortable, easing their pain, or simply offering a kind word, I find great satisfaction in providing both physical and emotional support. The gratitude from patients and families reinforces my dedication to this role. It's incredibly fulfilling to know I contribute to someone's dignity and healing. 6. How do you assist patients with daily living activities? Bathing, dressing, toileting? I assist patients with daily living tasks by first assessing their level of mobility and independence. I always explain each step, offer choices, and ensure privacy and comfort. For bathing, I use warm water, gentle techniques, and assist only where needed. While dressing, I consider weather, patient preferences, and mobility limitations. During toileting, I use proper hygiene practices and offer respectful assistance, always maintaining their dignity and making the process as smooth as possible. 7. What steps do you take to ensure patient safety when transferring or repositioning them? Patient safety during transfers begins with assessing their mobility level and using proper equipment like gait belts or mechanical lifts. I always ask for help if needed and explain the process to the patient to reduce anxiety. I follow body mechanics to protect both the patient and myself. Repositioning is done regularly to prevent pressure ulcers, and I ensure the cool light and personal items are within reach afterward. Communication and caution are key. 8. How do you take and record vital signs accurately? To take accurate vital signs, I use clean, calibrated equipment and follow standard procedures for each measurement: temperature, pulse, respiration, and blood pressure. I ensure the patient is at rest and comfortable before starting. I double-check readings that seem abnormal and immediately report critical changes to the nurse. All readings are documented promptly and accurately in the patient's chart or electronic health record. Accuracy and attention to detail are crucial in monitoring patient health. 9. How do you handle a patient who refuses care or is uncooperative? When a patient refuses care, I first try to understand their concerns or fears. I remain calm, respectful, and empathetic, offering reassurance and explaining the importance of the care task. I give them space and revisit the situation later if needed, always involving the nurse for further support if refusal persists. Building trust and showing respect can often help change a patient's mind. I never force care but prioritize communication and patience. 10. What do you do if you notice a change in a patient's condition, e.g., sudden confusion, difficulty breathing? If I notice a change in a patient's condition, I stay with the patient to ensure their safety while immediately alerting a nurse or medical staff. I provide clear, concise details about the symptoms, such as when they started and any other observations. I do not attempt to diagnose or treat, but follow the care team's instructions. Timely reporting of changes is critical for early intervention and can prevent more serious complications. 11. How do you prevent and manage pressure ulcers, bed sores? To prevent pressure ulcers, I regularly reposition patients every 2 hours and use pressure-relieving devices like special mattresses and cushions. I monitor bony areas for redness or skin breakdown and report any concerns immediately. I also keep the skin clean and dry, apply moisture barriers as needed, and ensure patients are hydrated and receiving proper nutrition. Good hygiene, routine skin assessments, and documentation are vital in early detection and management of pressure ulcers. 12. Describe your experience with patients who have dementia or Alzheimer's. I work with many patients with dementia and Alzheimer's and understand the importance of patients' routine and compassionate communication. I use simple language, calm tones, and visual cues to reduce confusion and agitation. Redirecting behavior and validating emotions are key strategies. I always maintain their dignity and involve them in care decisions when possible. My goal is to create a safe, supportive environment that reduces stress and enhances a sense of familiarity and comfort. 13. How do you maintain a patient's dignity and privacy while providing care? I always knock before entering, explain each step before starting care, and ensure curtains or doors are closed. I cover patients appropriately during bathing or dressing, and only expose the area I'm working on. I speak respectfully and encourage independence whenever possible, allowing patients to do tasks they are capable of. By treating each person as an individual and protecting their personal space, I help maintain their dignity and ensure they feel respected and valued. 14. How do you practice proper hand hygiene and infection control? Proper hand hygiene involves washing hands with soap and water for at least 20 seconds or using hand sanitizer before and after patient contact, after handling bodily fluids, and after removing gloves. I follow standard precautions, wear appropriate PPE, and disinfect surfaces as needed. I also ensure that patients and family members follow infection control measures. Staying updated on protocols and adhering to facility policies are essential in preventing the spread of infection. 15. What PPE, personal protective equipment, do you use and when? I use gloves for all direct patient care, especially when handling bodily fluids. Masks and eye protection are worn when there's a risk of splashes or airborne pathogens. Gowns are used during contact with infectious materials or patients on isolation precautions. I always follow facility guidelines and infection control policies. PPE is vital for protecting both patients and staff from infections, and I ensure it's used correctly and disposed of properly after use. 16. How do you handle a situation where a patient falls? If a patient falls, I remain calm, assess their condition without moving them, and call for help immediately. I stay with them, reassure them, and check for responsiveness or visible injuries. After help arrives, I assist with transferring them safely. I document the incident and inform the nurse right away. I also help evaluate what caused the fall, like loose rugs or wet floors, to prevent future incidents and ensure patient safety moving forward. 17. How do you communicate effectively with nurses, doctors, and other healthcare staff? Effective communication involves being clear, concise, and respectful. I report changes in patient conditions promptly and accurately, using objective observations. I actively listen to instructions and ask questions if clarification is needed. During handoffs or shift reports, I ensure all relevant information is shared. I also maintain professional boundaries and a cooperative attitude, understanding that teamwork is vital for quality patient care. Good communication builds trust and ensures continuity of care for patients. 18. Have you ever had a disagreement with a coworker? How did you handle it? Yes, I've had disagreements, but I always approach them professionally and respectfully. I focus on finding a solution rather than placing blame. I listen to the other person's perspective, express my concerns calmly, and try to find common ground. If necessary, I involve a supervisor to mediate. Maintaining a positive team environment is crucial in healthcare, so I prioritize open communication and mutual respect to resolve conflicts and ensure smooth patient care. 19. How do you prioritize tasks when you have multiple patients needing care? I prioritize tasks based on patient needs, urgency, and care plans. I first attend to patients with immediate health concerns, such as those needing medications or vital signs monitoring. Then I address personal care needs, like toileting and hygiene. I stay organized with a checklist and adjust as needed throughout the shift. Communication with a nurse helps clarify priorities. Time management and flexibility are key to ensuring every patient receives timely and appropriate care. 20. How would you handle a situation where a family member is upset or complaining? I listen attentively to the family member's concerns without interrupting and show empathy and understanding. I remain calm, avoid becoming defensive, and thank them for bringing the issue to my attention. If it's within my ability to resolve, I take action. Otherwise, I escalate the matter to a nurse or supervisor. I always follow up to ensure they feel heard. Open, respectful communication helps maintain trust and strengthens the patient-family caregiver relationship. 21. Describe a time when you went above and beyond for a patient. One time, a patient was feeling very lonely and homesick. I took time during my break to sit and talk with her, learning about her hobbies. I then helped her video call her family and even brought in books she liked with the family's permission. She was so grateful, and it lifted her spirits. It reminded me that emotional care is just as important as physical care and how small acts can make a big difference. 22. Tell me about a difficult patient you cared for and how you handled it. I once cared for a patient with dementia who frequently became agitated and combative. Instead of taking it personally, I stayed calm, maintained a soft tone, and tried to redirect his focus to something comforting, like a favorite song or photo. I also learned his daily routines and triggers, which helped reduce outbursts. Building rapport and being consistent helped gain his trust over time. Patience, empathy, and understanding were key to improving our interactions. 23. What would you do if you saw a coworker neglecting a patient? If I witnessed a coworker neglecting a patient, I would intervene immediately if the situation put the patient at risk. Then, I would document what I observed and report it to my supervisor or the appropriate authority following facility policy. Patient safety and ethical care are my top priorities, and it's essential to advocate for those who can't speak for themselves. I understand the importance of accountability and upholding professional standards in healthcare. 24. How do you stay calm in high-stress situations? I stay calm by focusing on the task at hand, controlling my breathing, and maintaining a solution-oriented mindset. I rely on my training and experience to guide me and prioritize patient safety. During emergencies, I communicate clearly and follow protocols. Afterward, I debrief and reflect to improve my response next time. I also use healthy stress relief techniques outside of work, such as exercise and mindfulness, to maintain emotional resilience and a balanced perspective. 25. Have you ever made a mistake in patient care? How did you correct it? Yes, early in my career, I documented vital signs in the wrong chart. I noticed the error quickly, reported it to my supervisor, and corrected it per facility protocol. I also apologized and reflected on how to prevent it from happening again, including double-checking patient IDs and chart labels. Mistakes happen, but accountability and learning from them are essential. That experience made me more diligent and accurate in my documentation and patient care. 26. How do you handle working long shifts overtime when needed? I prepare for long shifts by staying well-rested, hydrated, and energized with healthy snacks. I pace myself and take scheduled breaks to avoid burnout. I maintain a positive attitude and focus on teamwork to support others and stay motivated. When overtime is needed, I remain flexible and reliable, knowing patient care comes first. Time management, mental endurance, and commitment to my responsibilities help me handle extended hours without compromising quality of care. 27. What do you do to stay updated on best practices in patient care? I stay current by attending in-service training sessions, reading healthcare newsletters, and taking online courses related to patient care, infection control, and communication. I also learn from experienced co-workers and seek feedback to improve my skills. Staying updated ensures I'm providing safe, evidence-based care that aligns with current standards. I believe continuous learning is essential in healthcare, where protocols evolve and patient needs change. It helps me remain competent, confident, and professional in my role. 28. How would you handle a situation where a patient confides in you about personal issues? If a patient confides in me, I listen with empathy and without judgment, offering comfort and maintaining their confidentiality unless it involves harm to themselves or others. I acknowledge their feelings and inform them that I will notify the nurse if necessary for further support. It's important to respect their trust while ensuring their safety and well-being. I avoid giving personal advice and instead focus on emotional support and connecting them with the proper resources. 29. Why should we hire you over other CNAs? You should hire me because I bring a strong combination of experience, compassion, and dedication to quality patient care. I consistently go above and beyond to ensure patients feel respected, comfortable, and safe. I am reliable, hardworking, and a great team player who communicates well with staff and families. My proactive attitude, ongoing commitment to learning, and passion for caregiving make me an asset to any healthcare team, especially in delivering consistent and compassionate care. 30. Do you have any questions for us about the role or facility? Yes, I'd love to know more about your patient-to-CNA ratio, the support available during high-demand shifts, and any opportunities for professional development or additional training. I'm also curious about the team culture and how CNAs are involved in care planning. Understanding these aspects helps me ensure I can contribute effectively to your facility and continue growing within a supportive and well-structured healthcare environment. Thank you for watching our Top 20 Certified Nurse Aide interview questions and answers. We hope these insights help you feel confident and prepared. Don't forget to like, share, and subscribe for more career tips, interview guidance, and professional development resources tailored to healthcare professionals like you. Best of luck.